Hi, everybody. Welcome to the CanPassWillPass podcast. I am Dr. Ahmed. I'm a GP now in full-time medical education. My passion is to get you through not only medical exams in the way that suit you best, but to inspire you to have the best career that you can in medicine, whatever field you're in. And hopefully this podcast is going to go a little bit of a way to do that. I'm really, really proud and honored to be joined by Dr. Adnan Ahmed, a psychiatrist based in Wales. I'm going to be hopefully hearing a lot of his tips, tricks, ideas, and a bit of inspiration for you as clinicians. Hi, Raja. Welcome.
Thank you very much for inviting me. Hi.
No problem. Great to speak to you, Raja. And we've known each other for how long now? Probably a couple of years, I'd say.
Yeah, I think we met over online forums, and then we met in person as well.
That's it. Social media is a powerful thing, and we met probably a couple of months ago for the first time, and it felt like I'd known you for ages.
Yeah, I think exactly, yes.
And that's the power of social media. And we'll talk about social media later, because I know you do a lot of stuff on social media. And for you guys who don't know Raja, and there probably aren't that many of you anymore, Raja is really big on social media. There's a lot of stuff, helps a lot of IMD doctors, works across different forums and different streams, and we'll talk a bit about that going forward. But social media is a big part of Raja's life, and that's how we met. So I'm sure you guys have seen some of his work already. So Raja, take me back to the beginning then. Tell me about med school, a bit about your memories of med school, and how you ended up coming to the UK. Tell me a bit about your story.
So I'm originally from Pakistan, and I started my medical college in 1997, and I finished in 2003. And around the same time of final year, I was thinking about going abroad and exploring different options. I started looking into how a doctor can come to UK. And at that time, we didn't have that many social media forums and information out there. So we have to really contact our seniors who were already out there and ask them what is the procedure. It was a difficult time, to be honest. Then I started my prep for the English exam, which was IELTS. And then I did my PLAB 1 while I was doing my house job. And then right after that, finishing my house job, I came and did my PLAB 2 and started working in UK since 2005.
2005, okay. Okay, so about 15 years.
Yeah.
Wow, okay. And what was it was it always UK? Was that always the plan, or when did that kind of come into your thinking about that's where I'm going to end up, or that's where I'm going to work?
It wasn't, I looked at different options at that time. US Assembly was one option. Going to Australia was another option. I looked into the Medical Council of Canada as well.
Okay.
Then I looked into UK. So I thought at that point, even now, I felt that it was more easier for me to come to UK.
Okay. Yeah.
The training structure was, I thought, was very well organized for psychiatry, that I can come in and join in and start work here.
So you mentioned psychiatry there, and obviously that's where your career has now moved. Was that always your plan? Like, was psychiatry always for you?
This is an interesting question. I sometimes think myself, then what point? People do ask me a lot, when did you actually thought about becoming a psychiatrist? And I try and go in my memories and think, what was the point when I actually chose that? I would say around in fourth year or final year time, I was studying a lot about psychology.
Okay.
That was through internet. And I started reading about some famous psychologists and their work. And it was all very fascinating, absolutely fascinating how a human mind works,
yeah.
How our emotion works, how we react to certain situations, how we don't react to certain situations, how we see the outside world. And then at the same time, when I started reading about how significant impact the mental illness can have on somebody's life, and I thought, this is something I need to explore more. The thing about psychiatry is, when you start reading about it, when you start going into it, it's just more and more and more exciting, and it's just sort of almost like traps you. It's so exciting that you just don't want to leave it, basically.
So pretty early then you're into this road, and any regrets?
Oh, I don't have any regrets. I think it was a specialty that suits me, and if I've given another chance, I will still become a psychiatrist.
Yeah. It's amazing. And now you're based in Wales. Which part of Wales?
South Wales, yeah. So I live in Sport. So,
okay.
Yeah.
And always been there since you came to the UK, or I see a lot of doctors who come these days, and before they end up in specialty training, that they've worked in pretty much every corner of the UK.
Yeah, this is something an IMG needs to think about carefully. When you come to UK, you will have to be flexible and you have to move around a little bit. So when I came here, I was in Wales, but the first training job I got was the foundation year 2 fixed term job, which was in
Okay.
Somerset. So I have to go to Somerset. Well, my wife actually got a job in Wales, so she was working in Wales, and I was working in Somerset.
Okay.
And the next time I got my training job was the CT one in psychiatry, and that was in Essex. Again, Essex in Wales is around 3 hours, 3.5 hour drive. But I lived in Essex for a year until I got the interdeanery transfer. Requesting that my wife is based in Wales, can I please go back to Wales?
So you started psycho training in Essex for a year, and then you got that transfer. That's not easy in itself. And I hear a lot of IMD doctors across various specialties. Obviously, GP training is the one that I know more about. Trying to do transfers in the middle of their training, or kind of starting in one place, thinking, "Oh, it's okay, I'll do a year, and then I'll transfer somebody else somewhere else." I don't know what it's like in psychiatry, but it's not easy to do that in general practice training. Is it okay in psychiatry? Is it doable?
No, it is. It is still difficult, but you see, in psychiatry, we have an advantage. We had a lot of free training places because our recruitment wasn't going to 100%. So when you have training places empty in other deaneries, they are more likely to accept you. If a deanery has full set of great trainees, then they might find it difficult to accept you and fit you in their training program.
Yeah.
I think that's the major difference.
And it's something that I think it's worth knowing for IMDs. It's not as simple as I'll do a year and then I'll transfer. Like, it's something that, when you take on a training post, you've got to almost accept, I suppose, that this could be where you're going to be for the next 5-6 years.
Yeah.
Which is not an easy thing to do when you've already shifted from one country to another, and then maybe ending up in a place that you didn't have top of your list.
Yeah.
Is not easy. So I'm going to go back a little bit. Let's think about your med school. As we do a lot of, obviously, exam training. And I remember my own medical school exams. I don't know if you remember med school much, exams much.
I think that was a very tough time, I must say. You see, as a student, that is probably the best time of your life you're having at that time. But you see, you start your medical school when you are still in your early, or sort of, you can say, a late teenage. You start around that time.
Yeah.
And then you become you go into your adulthood around the same time.
Yeah.
So that would be really challenging. And on top of that, if you add exams, uncertainty about exams, uncertainty about your job, uncertainty around your your life, that can make it a bit tough, to be honest.
Yeah.
But I think we coped very well. I had a very good set of friends, and we used to study in a group, and we enjoyed our life at that time. We did a lot of traveling around in Pakistan, different parts of Pakistan. So we used to have a really good fun time around.
Where was med school? Whereabouts in Pakistan?
It's a city called Hyderabad.
Hyderabad.
So there's a medical school in Jamshore, which is outskirts of Hyderabad. So I was there.
Is that where you were based anyway? Is that where you were from?
Not exactly, because I grew up in a city called Mirpur Khas, which was actually even further away from Hyderabad.
Okay.
When I went into med school, my whole family was actually by that time living in Hyderabad.
Do you remember any particular exams? Do you remember any exams that you didn't do well in? Any exams that you didn't clear? Did these stick in your mind, or were you a student who flew through everything without any trouble?
I was always an average student, to be very fair with you. And I used to just do enough to pass the exam. I was never in any of the top leagues. But I think my final year exam was very tough because around that time my father got unwell.
Okay.
He was ill for a significant amount of time, and that obviously took a lot of toll on my personal circumstances.
Okay, but did you flunk any?
No, I didn't fail.
Oh,
I didn't fail, man. I used to, as I said, I was when I call myself average student, I used to just do enough. I still think I do the same thing. I just do enough to pass through.
yeah, and that's what a lot of people do, right? And ultimately, no one really remembers whether you got 100 or whether you got 70 or the pass mark. And obviously I do a lot of training with people, and they get very stressed about passing, and we talk a lot about aiming for 100 and you'll easily clear, rather than maybe aiming for the pass and then having that stress of getting down. But it's good that you remember your med school exams. I guess you had to do a lot of just learning and learning of material, and because practical exams, when did they come in? I mean, were they towards the end of med school, or because systems are different all over the world, isn't it?
Yeah, we started our going to hospitals around third year time.
Okay.
So from third year onwards, we used to have some patient contact,
Yeah.
and our final exams were mostly, there was a lot of vivas, and there was short cases, long cases in every
Okay.
subspecialty. We have to do that. So
Did,
that was a tough time.
and
But
did you do psychiatry rotation in med school?
yeah, we did psychiatry routine, but it was very small.
Okay. How
Uh,
many days do you reckon you were
it
doing psychiatry for?
was only for a few weeks.
Few
Uh,
weeks.
and yeah, a few weeks. And even in our exam, we used to get very small amount of questions from psychiatry. So if you didn't read psychiatry, then you can still become that doctor at that time.
Yeah. Yeah.
But I think it has certainly improved since that time. Now students are spending more time in psychiatry and
Yeah.
reading about it more as well.
And you've done a lot of work going back home, haven't you? And I've seen some on your social media stuff that you go back and you do a lot of talks on psychiatry, isn't it, back home, which is a great thing. How's that perceived? How do you get these invites? Like, how does it all happen?
As you were saying, is around the social media. When you do stuff and put it online. And I started using social media more actively about 2 years ago, maybe 3 years ago.
Okay.
And at that time, I didn't realize how useful it could be. Because now, if I post on my social media, on my Facebook page that I'm going to Pakistan, if I put my traveling, check-in that I'm
Yeah.
going to
Yeah.
Pakistan, I'll get invite 3 or 4 people will call me and say, "Can you please come to our
Yeah.
medical school and tell us about this, tell us about that,
Yeah.
and we can arrange a talk for you." So I still, as you said, how did I get into those places? Last year I've been to 4 different institutes of psychiatry in Pakistan, and I gave them lectures. And I have maintained contact with the psychiatrists in Pakistan,
Yeah.
and I keep in touch with them. Some of them are my friends from a medical school, but some others I made friends through social media. Um, and every time I'm now going back to Pakistan, I've always informing them in advance, and they're always very happy to arrange some form of a training session or a talk or a workshop.
It's great, isn't it? And giving back and maybe dispelling a few myths,
Yeah,
giving people confidence, courage that, look, I've done it. If this is your passion, you can do it. It's invaluable, I guess, for people to have that kind of guidance. So I think it's amazing. And as you said, social media is great. We went to India last year, and just as you did, checked in Goa, and people said, "Look, if you're in Goa, can you do a session on communication skills?" I mean, this would not have happened, obviously, 4, 5, 6 years ago. It's amazing, and it connects everybody, and I think it's a great thing that you do. So you did your med school, came to UK. You were always into psychiatry. Tell me about PLAB. Do you remember PLAB much?
yeah, I do. Yes, I do.
You did PLAB 1 here, or?
No, PLAB 1 was in Pakistan, and
Okay.
then PLAB 2 had to come here. And at that point, we have to do some academies. I think people still do the academies.
Yeah.
So we used to get the notes in advance. We used to pay for the academic courses
Yeah.
in advance, and then you have to come to UK and practice in the academies.
Yeah. So now, obviously, what people do with PLAB, and a lot of people do, is they'll book the academies, book the training, they'll come here, do the academy, do the exam, then go home. Is that essentially what your story was when it came to PLAB 2? Do you literally just come to do the exam and then go back?
No, I think that was a little bit different then. What the jobs around 2005, it was difficult to get jobs. So a lot of people used to do clinical attachments.
Okay, yeah.
Right after or even when I was trying to do my PLAB 2, I was trying to apply for clinical attachments in different hospitals, sending out my CVs and asking them if I can come and work with you. So I had one lined up at that point, and that was actually in Wales as well, the first clinical attachments.
And now you come full circle, and now you're examining still?
Yeah.
How do you find that?
Do an exam. I've done the exam training, but this COVID-19 crisis happened, and I was booked to do the exam. But
you haven't done your first, but you're done, and you're ready to go when it all kicks off again.
Yeah,
it's great. I mean, I was a PLAB examiner. I don't do it anymore, but it was a great experience for me. I used to really enjoy my days going to the GMC building and doing my examining days, and I'm sure you'll love it as well. And it's nice to kind of go full cycle, go through an assessment that you've sit through. I know it's different. It's a different style of PLAB to exam when you would have done it, but I guess it's quite a nice feeling to go back the other way.
Yeah,
which is good, and hopefully that will happen fairly soon. We don't know when it's going to be, but let's see. Is education always been a part of your interest? Has it always been there, or has it developed recently? Tell me about your medical education.
No, I've done a master's in medical education, but I have been involved in education and training for a long time. I teach a lot of people in locally as well in my local MRC site courses, local university in Cardiff University. I've been examiner for them as well.
Okay.
Then in MRC site we have an exam called CAST, and we've been since
Yeah.
I passed my CAST exam, we have been doing CAST practice for the deanery here as well. That was since 2012. And as the other thing you mentioned around mental health, and especially going back to Pakistan, there is always lack of awareness.
Mm.
Mental health information. So I'm always interested in fighting the stigma against mental illness, which
Yeah.
stops a lot of people getting help, and also improving the quality of education and training in Pakistan as well.
And that's something that you've started to do a little bit anyway with going back and doing these talks.
Yeah, and not just going back. Now I've done a few talks over Zoom as well,
Oh,
which is
fantastic.
which was a very interesting experience that I'm learning from that as well. I I like I like my sessions to be very interactive. I don't like standing in front of an audience and giving them a lecture for an hour. I
Yeah.
always try and make it as a workshop, and I can
Yeah.
actively involve my students. So
Yeah.
but that was a little bit difficult to do while you were doing through Zoom, because you can't even. I wasn't even able to see the whole audience. But I think that is again a learning experience for me.
Mm.
Um, and as the time go on, I will find tricks and things that I can use to involve them more actively as well.
Yeah. Well, certainly what's happening now with COVID, obviously, is people are adapting, and these things that were once talked about as maybe it'd be a good idea to start doing these kind of things, and now we're forced into doing all this kind of stuff, and it's going to change the way people teach, practice, communicate, I'm sure, going forward. But so let's talk about your other roles then. So we've mentioned a few already. So obviously you're a consultant psychiatrist, and that's elderly care psychiatry, isn't it?
Yeah, yeah, old age psychiatry. Yeah.
Old age care. We'll talk a bit about how you got into that scene as well. Examiner, obviously, for GMC. You do other teaching in and around your local area. Other roles, Raja, or does that keep you busy enough?
I am also, I mean, as in the clinical role, I am a clinical supervisor for GP training and an educational supervisor for psychiatry core training and also higher training as well.
Yeah.
Those are my roles as well. Then I'm trying to develop some research experience as well around psychiatry. And when I did my medical education MSc, we did a research package around medical education, and that has given me a lot of ideas of when we think about research, we always think about patients and medications and all of that randomized controlled trial. But there are other ways to do research as well, involving especially around education. How can we improve the quality of education by doing research into that?
Yeah,
That is my area of interest now.
Which is amazing. And medical education is, that's obviously my passion. That's what I do day in, day out, and trying to find new ways to engage, new ways to teach. The reason we have so many different types of teaching and products is because we're trying to engage with as many different styles of learner as they are. And that's always going to be improved and worked upon. So what you're doing there, I think, is great, especially because you have so many educational roles as well. Tell me a little bit about, Raja, when you first came to the UK, and we're going back a little bit here again, what fears, perceptions did you have that either turned out to be true or not true?
I joined this Facebook group, which I think you are on this as well, the IMG Facebook group, where we met, and I met some other doctors as well.
Yeah.
So the reason I joined and I started reading, when I was reading the post, I can see myself in those young IMGs. All their anxieties, all their fears about UK, am I going to get a job? Am I going to get in the training or not? Is training going to be good standard? Am I going to pass the exams? And, how am I going to end up? So all of these fears are sort of quite natural and quite common. As I was explaining, when I came to UK, I was only 26 years old of age, and you can imagine life is difficult as a 26-year-old anyway. 26-year-old just qualified and also unemployed. On top of that, if you are also moving the country as well, there's a layer of uncertainty. So that was a difficult time. There's no doubt. Then when we first came, there was shortage of jobs as well here in UK, and we used to worry about that where will we end up. But then again, you have to sort of overcome those anxieties by taking one step at a time. And this is why I advise and everyone, you can't worry about job sitting in Pakistan when you haven't even done the IELTS exam. You need to start taking those baby steps and slowly and gradually. And then you will end up somewhere where you will have those chances.
We talk a lot about having big goals, like you know where you're going, you know where the end bit is, but if you start thinking about the end bit too much, then you're never going to make any steps because it seems too far, isn't it? But as you said, it's that balance of knowing where you want to go so that you have that drive to move, but then breaking it down, isn't it? And thinking, well, I can only do as good as I can as my next step. I can only make the next step as good as it possibly can be. And eventually you will reach that end point. And hopefully by then, your end point has been pushed further anyway, right? Because as certainly with myself in medical school, it's all about, I just want to become a doctor. I just want to pass my final exam, then everything will be fine. And then you become a doctor, it's like, well, no, I just want to get into a good job. Once I get into a good job, everything will be fine. Then I just want to get into GP training. And then I just want to get out of GP training. Like it's always the next step, and you're almost pushing those boundaries. But thinking about small steps in the day-to-day life of things is so crucial, isn't it? Otherwise you get overwhelmed, I guess.
Absolutely. And I think I'll share something with you now. When I was offered my first consultant post, people would say I was very happy and, very satisfied that I made it. It actually made me a little bit low because I thought, is that it? Is this going to be the end job for me? Am I going to retire on that job? What else is out there for me? Am I going to stop doing all the things I was doing? But as a trainee, I was very active doing all the quality improvement projects, research, all the medical stuff in medical school and trainees. As you said, you really have to challenge yourself throughout your life. You have to really set up new goals, set up new challenges for yourself if you really want to move forward.
100%. And not just in medical, we do a lot of work around exams, and we talk about, set your goal at 100%. Doesn't mean you're going to get 100%, but set it 100% because it's a mindset thing, isn't it? You aim big, and then the rest of it kind of slots in. And it's with life as well. And like you said, if you don't keep adapting that goalpost, if you don't keep pushing it, then when you reach it, you think, as you said, you kind of feel a bit deflated. Well, is this what all these years were for? But I guess now that you've kind of reached that point, you're now obviously doing so many other things, which probably, before you reach that point, you weren't even thinking about, I guess. Like all this extra help with IMG doctors, and because at that point it was all about getting to that point where we can then relax and life is good and everything is going to be fine. But IMG doctors, so you do a lot on social media, and I know that, and I see your posts, and I see how helpful they are and how people resonate with those posts and how they are getting to know you through the medium of social media. But what else are you doing for IMG doctors? Have you got any more plans for IMG doctors? Have you got any? And what else is coming up in terms of your thinking, or are you kind of just seeing how it goes and adapting to things when they come to you?
So I've got a few things planned. I don't know how far I'm going to go with them, but one of them is actually to set up a YouTube channel or a podcast, where I can interview psychiatrists from different subspecialties. And they can tell about different subspecialties to the trainees. So, for example, somebody wants to know about what is forensic psychiatry, what does it feel like to be forensic psychiatrist. So I have an interview of a forensic psychiatrist there, so they can go and refer to. The second thing was setting up something around, as I said, health education in Urdu language for Pakistan. Again, interviewing psychiatrists on their experience of how to deal with different mental illness and how to explain different mental illness in a simple language. Then the third thing I'm thinking about is improving my knowledge of technology like Zoom and other stuff, which I can use to educate while I'm sitting in UK. So rather than me going to Pakistan and giving those lectures, if I can set up sort of a way of doing it from here, I think that will be, especially in this COVID sort of atmosphere when you can't even travel.
Yes. I mean, I think those three things are going to be invaluable in different ways. I mean, certainly, having been through GP training and ending up being a GP, you think about psychiatry, you're aware, even as fellow clinicians, there's old age psychiatry, elderly care psychiatry, old and forensic psychiatry and these sort of things. But to know the ins and outs about what does each one do? What does a career entail? What are the kind of steps that need to get there? I think, for a psychiatry trainee, that would be invaluable. So I think that's an awesome thing. And as you said, doing the other side of it for people back home, I can see that being a huge help. The perceptions of how psychiatry is in different parts of the world, I guess, is different. But giving people that honest advice in your own language, I think would be a great thing for them.
Yeah, I think that is the aim. Let's see how it goes.
Yeah,
it might be a success. It might not be. But you always have to try these things and see.
Absolutely, like you never know, right? If you give it a go, the amount of things that I've done that haven't worked, the list is huge. But if one thing out of 15 works, then and it helps and it adds value.
Yeah.
And these are the kind of things that keep you going, isn't it? And get you through those challenging times where you feel, well, I'm in a small place and I can't do much, or whatever it might be. These things keep pushing you.
Yeah, pushing you to the next level. I think that's the main message, that whatever you're doing, whichever level you are on, you need to look at the next level and try to push yourself.
Yeah.
And try new things to see if you are gonna go to the next level or not.
Yeah, absolutely. And before I forget, I want to talk a bit about old age psychiatry and why that ended up being your field of choice. Again, is that something that has been there for a while with you, or is that something that you've tried a few different subspecialties and found this one resonated best?
The reason I mentioned my YouTube channel or those videos where I can interview subspecialists in psychiatry is because around the world, maybe the subspecialties are not that much developed. Especially in Pakistan, when I speak to the psychiatrists there, we are getting one kind of psychiatrist who does everything. Subspecialties are developing there, but not at a pace of what you see in UK. So as part of our core training, we have to rotate between different subspecialties of psychiatry.
Yeah.
And that is a time when you are basically exploring, what kind of psychiatrist I can become.
Yeah.
So old age psychiatry has some advantages, which I really like. For example, in old age psychiatry, we are dealing with elderly patients, and you know that they will have comorbid problems as well. So it helps you to keep your medical knowledge up to date as well.
Yeah.
You have to have some degree of medical knowledge to actually work in old age psychiatry, because otherwise and I think that was the main reason when I saw that. I thought I'll be doing psychiatry, but I won't be sort of completely out of touch with medicine.
Yeah.
And I can do bits of that as well.
Yeah. So that you can see that as why that would be a driver, for someone to choose a particular specialty rather than kind of falling into something that they never really wanted to end up in, but ended up in it. You had a clear reason why you wanted to do it, and that's why I guess you made a success of it, and why you're doing so well with it. But I mentioned success there. How would you? Because a lot of people look at you and think, Roger, this is a successful guy. Like he's done so much. He's doing so much. He's known around the world already. He's getting invites to do this, that, and the other. You're coming to our conference in June. Touch wood if it's going ahead. I don't know. You're a successful guy in the eyes of many. But for you, what does it mean? Like, what does success mean? Do you feel successful? And how would you put that as a thought of am I or not? How would you see it?
This is a difficult question I think you've asked. I believe success means different things at different stages of your life. So what I thought would be making successful when I was 18, as you said, at that point, it was all about getting into medical school and becoming a doctor. And then when you become a doctor, you set your bar somewhere else and say, this is what success looks like. And when you get there, you're already looking forward to something else. At this point, as you mentioned, all of the things I'm doing, but I also am a family man as well. I got three kids. I think some of you can see the pictures of my kids.
Yeah.
So I think for me, it's also important for me to be successful, that my kids find me a good dad, and that who gives time to them, who spend time with them, and when they grow up, they have good memories of me, and who feel that I'm approachable. So I think, as you said, the question you asked, what success means to you, it means different things in different stages of life.
Yeah.
Whatever you think is success to you now, when you get there, you will have another definition by that time.
And that's key, right? It's the evolution of stages of life and adapting, you know, and things may not go exactly to plan, but it doesn't mean that things haven't been successful, right? And if you have your own aims and agendas, then you perceive yourself as successful. But what other people are going to see is going to be a different story, and what they will put as your success will maybe different to what you are. And I suppose we see a lot of doctors who, from the outside, people say they're incredibly successful, but inside that they don't feel that, or they're struggling, or they have, you know, they don't feel like they've done enough or achieved enough. And the family aspect, I think, is huge. You know, I've got 2 kids myself, and that's success there is just as much as success in career and business and education. And what about in 10 years? Where are you going to be, Raja? What are you going to be doing? Are you going to be doing? Are you going to be on TikTok or Snapchat? And what are you going to be doing in 10 years? That won't be around in 10 years, but
you know, when you were talking about setting long-term and short-term goals, you know, I normally don't set up that long a goal. In 10 years' time, I don't really know where I would be. But, you know, I mean, let me tell you some ideas I had. I maybe in 10 years' time, my kids would be in university. My older kids would be in university.
Yeah.
So I want them. I'm really hoping that they have. I've given them good education and good training, that they find themselves in a top British university doing something that they really enjoy.
Yeah.
That would be a really satisfying thought for me, you know, if I'm there.
Yeah.
From the medical education point of view, as you were saying, I like to grow my role in medical education and use more of social media and different platforms and reach out a bit more, you know. So I'm hoping in 10 years' time, I may have had a better reach. You know, I may have trained more psychiatrists, inspired more people to take psychiatry, and then help those psychiatrists to pass their exams and then go forward.
That's a no-brainer. Like that's, you know, the way that you do that right now already. If you maintain the passion to do that, that's only going to go one way, and more people are going to know you through social media. I mean, let's just quickly run through your social media. If people want to find you on social media, if they don't know where you are, what are you on? What streams are you on, and what are your tags so people can find you?
All right. You can find me on the Facebook. I've got a personality page there as well, and a personal account.
Just type in Dr. Raja.
Adnan, you'll find you. If you search that, you'll find me to do that. Then we have a Facebook group as well, psychiatry training, and I'm an admin for that. And then I tweet as well, and I tweet around a lot of mental health stuff, and also to do with the training, psychiatry training, and the mental health news around.
What's the handle? What's the handle?
_ Dr. Raja. You can find me there.
Have a look for that if you're on Twitter.
Yeah.
Any others?
I normally I'm using my social media just for the help of IMGs and for psychiatry training.
Yeah.
You won't find any thing to do with the other stuff. You know, I don't try and post around Brexit and stuff like that. You know?
Yeah. You're quite you keep to your niche, isn't it?
Yeah.
Which is sometimes important, because, you know, there's so much noise out there on social media. You want what you put out to be of quality and value, and I suppose something that you know about.
Yeah.
People are going to come to you for advice, help, opinion, and doing what you know about, I think, is key, and that's why you're building such a quick reputation for helping out a lot of IMG doctors, which I think is amazing. Have a look at Raj on social. Twitter, I see some great stuff from here. Very different to what you put on Twitter than what you put on Facebook. I think that's using social media streams really well, because not everyone is just a copy of everything else. So I think that's really good. So, you know, I think a lot of inspiration, hopefully, people can gain from your story. There's many other things we probably can talk about, I'm sure. But, you know, inspiring medical students, junior doctors, both into psychiatry and IMG doctors in general from abroad, I think is something you do amazingly well. And I'm sure a lot of people are very grateful for what you do, and hopefully you will carry on doing it going in the future. I
must say that I'm quite inspired by you as well, and I learn a lot from you. You may not realize that, but the way you are using social media for medical education and different platforms, you know, that is something. And I always sort of take advice from you as well, which platform is better, you know, what to do, which technology you use. And you have been a great help to me as well.
Thanks, Raj. I mean, as you know, we use everything and everything. You know, whatever's there, I'll use it. If I can teach with it, I'll use it. And the key with social media is I guess you have to adapt to what people want and different streams rather than saying this is how I want to do it and you must follow our way. And that's the only reason why I do so much on social media. But it's great that you're doing it as well, and hopefully long may it continue. Give me three last high quality tips for IMG doctors who are thinking about a career in psychiatry. 3 strong things that maybe you thought that I wish I knew before I did this journey myself that would have really helped me.
Let me put it this way. If I had a time machine, and if I can go back and meet my 26-year-old self, so what will I tell that guy?
Yeah.
That 26-year-old Raja. I'll tell him that, that you are a great doctor. You need to have more confidence in yourself.
Yeah.
You have come that far, which is not easy. It's not easy to change countries and sort of adapt to a new culture and all that. You've done all that. That was an amazing achievement. Do not underestimate yourself. You will, and then hold my hand and say, you will be fine. Because I know at that point I had loads of anxiety, and I just wanted to tell myself, that you will be fine. Don't worry about it too much.
Yeah, and it's a great message. And the only challenge is that people don't listen or can't listen because of the stuff that's going on in their head. But it's a great message, and sometimes what I tell people is, look, you're not the first person to make this trek. This is a well-worn path. You may feel like you're on your own and you're the only one who's doing this, but it's a well-worn path, and there are many people ahead of you that have done the same.
I think the IMGs underestimate the anxieties or the difficulties they can face by changing a country, because when you are leaving a country behind, when you first come to UK, it looks amazing, really amazing. You go on all those tours and look at all those tourist sites, and you're really excited. But when you really have to live here, then you start realizing that you don't really have any friends there, and you don't really understand the culture maybe that well, and you find you are struggling to find your feet there. It takes a little bit of time to actually get used to everything. And for that, my top tip is that you need to start making friends as soon as you come to UK. I know you have to obviously keep in touch with your family and friends back home, but your social life is very, very important here. You'll do work and do good work, but when you come back home, you need to have some sort of hobby or friends or activities that really motivate you.
Yeah, just to give you that roundedness that you need in life, right? I mean, what's the point of just coming and getting the career you want, but struggling every day because you're missing everything else that you're in life that you thought should be there. So yeah, amazing. And yes, exams are going to get in the way, and yes, worries about job applications are going to get in the way, and yes, there will be challenges that you have to face. But in the bigger picture, it's your life is more than just which job do I end up in and do I clear this exam. So I think it's great advice, as always. And thank you so much for doing this. I think a lot of people are going to benefit from it. Please, if you're watching this, do contact Raja. I'm sure you'd be happy to be contacted for advice from people. If you want to know a bit more about us, then please have a look at our website, auroramedicaleducation.co.uk. We do a lot of teaching for PLAB 1, PLAB 2, GP entry, MRCGP, as well as medical school stuff as well. YouTube, Facebook, Twitter, Instagram. Please do have a look. Hopefully you found this podcast of some value. Hopefully you found it useful. And I look forward to meeting you on the next one. Raja, can we get you to do the hashtag? Hashtag CanPassWillPass. Raja, can I get a CanPassWillPass?
Hashtag CanPass and will pass.
Amazing. Thank you, Raja. You've been super.
Thank you very much.